Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal video today. So we've got two patients in this compilation. The first patient's come through. You can see this ear canal is really blocked up. So we've got a really hard piece of wax here. There's a sheen to the top of the wax, which means that this patient has been using some olive oil in here. But as you can see, it's not really penetrated into that wax. Now sometimes if the wax is really hard, when the oil does sit on the top, it doesn't always penetrate into it. So it doesn't always soften it as much as we'd like. So what I'm doing here is using the standard size Tube just to gently probe along the outside edge of this wax here. You can see we're just lifting from that right side, and do you see that little piece of skin just lift up towards the suction? So this is a piece of dry skin that's sandwiched between the canal wall and the edge of the wax itself. So I'm just going to try and work around the edge of that and see if we can take that away, which will allow us a little bit of wiggle room in here then. You can see as we got a good grip on here, as we start moving the wax and rocking it back and forth, we're just starting to see a little bit of movement around the outside edge. It's just starting to pull away from the canal walls a little bit better. And we're just lifting the bottom edge. So we're just getting a little lip at the bottom of the wax here. You can see the olive oil working underneath this as well, which is going to help us in the long run because it's going to help that wax to slide across the canal wall a lot better. There we are, really starting to lift this piece of wax now. You can see it's almost on its way out. It's just lifting up enough to get this little angle. So we're going to use the crocodile forceps on here. We're going to grab just along that little piece of dry skin. Sometimes we can use that as almost like a little sled to slide the wax out. But what you can see here is as it's pulled away, it's just pulled this long strip of dry skin that's been sandwiched between the wax and the ear canal wall away there. There we go. You can see we've got another piece there just lifting up underneath. Because we have created this little bit of a gap and it will have pulled some of this forward slightly. Sometimes then we're able to get a good grip on the wax itself. And you can see there's a lot freer movement now. So obviously that piece of skin was just holding the wax in place. So if we can just get rid of some of the rest of this little bit of dry skin here, you can see as we're pulling it, it's not quite got the sort of integrity within it to be able to hold on to that wax and pull this forwards. There we are, just trying to work this through. If you've never come across our channel before, guys, just to let you know, we post new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time. So if you do enjoy the video, then please consider subscribing. And we're just working this down the canal now. There we go. If you are watching us on Facebook and on Instagram as well, on IGTV, we do have a back catalogue of videos which are on our YouTube channel, Audiology Associates UK, as well for you to check out. So we're just managing to bring this forward. We're just folding the top end of this wax down now. There we are, just trying to find a little bit of an edge to get behind. So we've got it wedged in now, so the Jobson horn is going to go in. Just get over the top of it, roll this forwards. You can see it's actually rolling out of the canal now. There we are. Into the bowl of the ear, that little piece of wax is going to drop. There we go. So we're just going to pick that up now so you can see what that looks like. Just slowing it down so you can see, there we are, just quite a big chunk of circular wax, that one. We take a look behind it now, we can actually see the eardrum itself. Notice this section at the top here, that's actually the second bone in those ossicles and the three bones in the middle ear. It's called the incus, and that's the long process of the incus you can see dropping down. Because this eardrum is a little bit retracted, it means that that particular part of the eardrum is a little bit sucked into the space behind it, which can happen if you ever get the sensation like you want to pop your ears. That's what you're going to find in your ear canal. So quite a large piece of wax there coming away. Now this lovely gentleman came through the clinic this week. Basically, he's been using some drops to try and soften, some specialist wax softening drops, which you can buy over the counter. Now, we've talked about wax softening drops as opposed to olive oil drops. Now, wax softeners will actually break down the fats that bind the wax together, so it loses some of its structure. So you end up with a kind of like a mushy mess. But a lot of them have a peroxide or a bicarbonate base, which means they're alkaline in nature. Now, your ear canal is slightly acidic to stop any infection taking hold. So although it does break the wax down, sometimes people can have a reaction to those drops. You can see it's very liquid, very messy around the outside edge, whereas olive oil will keep the shape and structure of the wax, but just soften the outside edge. This just turns everything to like a gloopy mess. Now, as we take this away, all this kind of more liquid wax around the outside edge. Take a look at that eardrum. The patient's skin has actually reacted to those drops. So the skin of the canal wall is very red, very irritated, which is why I'm staying quite above it. But when you look at the eardrum itself, look how puffy that eardrum is. That's the tip of the hammer bone there, so the malleus bone, which should protrude just through the eardrum and come down at a diagonal line. But what you're seeing here is everything is so swollen around there, whereas it should be a really neat line going down. Everything's really puffy, it looks thick, it looks aggravated. So my advice to this patient would be to, when they're in the shower, just let a little bit of water trickle into the ear, just empty that out and just constantly keep flushing to get rid of all those chemicals out of that ear canal there. So you have to be quite careful what you do pop in there, and some people do get reactions to these drops. So this is the same patient, but their second ear, so no drops gone in here at all. Look at the difference in the wax and how much easier that is to remove, because you're getting this grip on this larger piece. It's more solid, so we're able to pull this down the canal far more easily. It's a bit too big to fit out of the canal now. We've got it to the outside edge. We're giving it a bit of a wiggle, see if we can work this out. There we go, out that pops. So you can see it's quite a substantial little plug there. And just got a little bit left behind, so we're just going to grab that section. And when we take a look in here, look at the difference between the ear canal walls and the eardrum itself in this canal that hasn't been treated with a softener. You can see, yes, that it's a much more normal color of skin here, so much more sort of a beigey color of skin. But yes, we've got this little bit of dry skin here, but that would have been in there anyway. But look at the difference in the eardrum when we take the crocodile forceps away. You can see the tip of the malleus there, the hammer bone, and you can see a very clear, defined line coming down. The skin is smooth, it's pearlescent, it's shiny, slightly translucent as well. What a difference you can see between those two eardrums. So yeah, you have got to be a little bit careful the type of drops you pop in. So this is what we remove. You can see we've got two great chunks there from either side. I hope you did enjoy the video, guys. If you did, then please leave us a thumbs up. And as always, guys, take care of yourselves and one another. And I shall see you again soon.